So how much paper is still used for medical charts, for prescriptions, anything related to the information about the patient's treatment? Because one of the challenges that we see in countries that are implementing national backbones and electronic healthcare records that patients can access online is that you cannot avoid healthcare institutions that will not somehow be connected to that backbone, which leads to inaccurate patient records.
It's all electronic, and it's electronic by law. You cannot provide a service within the healthcare sector if you're not connected. You have to be connected. So all prescriptions, everything is by when you have to revise a patient from one part to another, it's electronic, and you have to deal with that. Of course, the patient has a right to have their own patient record in a hard copy. So you should be able to do that, of course, and also work it together with the patient so they understand the terms and the languages and so on. But all work within the sector is electronic based.
The way we described it, it almost sounds that there's no interoperability challenges in Denmark. Is that a wrong statement?
There will always be. When I always say that technology is a good servant but a strong master, and wherever there are people present, there could potentially be problems.